Hello, ladies and gentlemen. I am Dr. Jacob Bonet, owner and clinical director here at Scottsdale Pediatric Behavioral Services. And today we have my good friend and colleague, Dr. Sarah Berger. Sarah, tell us a little bit about yourself.
Okay, so my name is Dr. Sarah Berger. Like he said, it's just like cheeseburger, it's spelled the same way. I am a licensed clinical psychologist here in the state of Arizona, but I have an added specialty in clinical neuropsychology. So I see kids all the way up through adults, so the full developmental lifespan, and I practice neuropsychology most often, most specifically.
Perfect. Dr. Sarah was nice enough to come join us today because we've had a lot of questions recently about what do I do if I think my child has autism, or what do I do if my child is starting to show signs of autism. So because Dr. Sarah is a great evaluator, I thought she'd be a great person to answer this question. So Sarah, a parent has a kid, let's say the kid's 2.5, 3 years old. They suspect something's going on. What do you think they should do?
Yeah, it's a good question. And the first thing I would do is seek out a quality assessment. And with autism in particular, that's getting harder than it used to be because we've really revolutionized the way we think about autism relative to how we used to. The current diagnostic system is quite a bit different. So kiddos who would meet criteria for diagnosis with autism now maybe wouldn't have 10 years ago. And because of that, we've got a lot of practitioners out in the community who have kind of an outdated view of what autism is and what it isn't. And so what I would do if it was my kiddo or someone that I knew is I would seek out a good quality in-depth evaluation to see, is this autism? Is it something else? What are we dealing with? What does this look like? And nowadays, really, a neuropsych evaluation is where you're going to get that. So that's what I would do first.
Sarah, you have years of doing neuropsych evaluations with children. Just to quickly review, what other kinds of assessment or ways could autism be diagnosed besides a neuropsych eval?
That's a good question. So autism as a diagnosis, as a label, technically if you just go through all of the diagnostic criteria and see whether or not they're present, you can diagnose autism. At different points in time, the state decides who's qualified to make that kind of a diagnosis if you're going to use the diagnosis for service provision. And really diagnoses are best couched in why are we needing the diagnosis itself? What are we trying to do on the basis of the diagnosis? But as a parent, you just want to know what you're dealing with, right? And part of understanding whether or not it is autism is understanding, well, if it is, what does that mean moving forward? What should I expect? And if it isn't, then what is it? And what does that mean moving forward? And what should I expect? So who does the diagnosis? It's going to entail different types of assessment. But if I want to know what it is and where we are and where to go from here, I want an assessment that's going to be more than, yes, you meet criteria for diagnosis with autism. I want it to be, okay, you meet criteria for diagnosis with autism, but what does that mean? And what are your current skill sets? And where are we now? And where do we want to go from here? And that's what you're going to get in a neuropsychological evaluation, which you won't get in a quick 15-minute diagnostic interview with a neurologist. Yes, you meet criteria, boom, you have autism. What assessment tools you use, it really depends, and that should be ideally tailored to the child and dependent on, let's figure out where the functioning level is and kind of go from there. But having said that, there are some kind of gold standards that have developed in terms of what assessments should be included for autism, and that really is tied to service provision.
So you were telling me earlier a little bit of a difference between a regular neuropsych eval and a developmental neuropsych eval. Can you tell us, because developmental neuropsych evals is kind of your specialty, what's the difference between the two?
Yeah, the difference really is not so much in the tools that you use, but in the way that you use them. So if you're a developmental neuropsychologist, you look at things a little bit differently. And you probably already heard me say a snapshot of functioning, because as a developmental neuropsychologist, that's how you view it. So especially in children whose brain development is still ongoing at a very rapid rate, when you do a developmental neuropsych evaluation, one component of that is assessment, it's testing. And that gives you a snapshot of where the functioning is now. But if you're looking at this as a developmental neuropsychologist, you understand where we came from to get here and where typical brain development would go, where brain development is most likely to go based on what is going on, what the assessment is. And now you have the opportunity to direct future brain development in a very principled way. Like, what are the current strengths? What are the current weaknesses? And with those weaknesses, what do we want to do different in order to tailor this brain development to maximize the capacity and the possibility? And that's what's different in developmental neuropsych than just neuropsych. It's this versus that. Here's how they're functioning. There you go.
So Sarah, you told us step one, get a really comprehensive, accurate evaluation. So step two after that evaluation is what?
So after you have a thorough assessment evaluation and we have a diagnostic picture, then education is hugely important. And the education starts with the family. If it's a kiddo, whoever is in their immediate frame of reference, we want to educate them on two components. One, what is the diagnosis? And what does that mean? And what doesn't it mean? Right? And that's really important because there's a lot of misconceptions out there about a lot of labels, but autism especially, right? And then, what does that mean for your child? So an important component of that assessment should include where are we now? And then the education of where are we now is principled, and it has to do with how that impacts their functioning currently, what they can expect realistically moving forward, and how much of that is malleable, and what we can do from there. And that education component includes very specific recommendations for treatment, for what types of learning environments are most likely to be appropriate, for how we should structure the setting in the home environment, all tailored toward let's set up the environment so that this individual can function in the best way possible. And let's make sure that we're not punishing them for being them, but instead celebrating who they are, understanding who that is, and directing their ongoing development in a way that we can optimize all of the things that they're capable of achieving, which sky should be the limit.
So besides parents using their neuropsych evaluator as their source of education in the beginning, what else can parents do to really thoroughly educate themselves about their child's diagnosis, how that diagnosis affects their child, and how it's going to affect them in the future?
Yeah, good question. So once you have a good diagnosis, so assuming you've had a good assessment and you know what that is, and you meet with the evaluator and you get their explanation of what that is, and you see where your child is within that, then you read. And you don't believe any one person, and you read as much as you can get your hands on, but you want to have some people in place, some treatment providers that you trust, that you recognize, know what's out there and what the truth is, so to speak, and then you check your understanding with that person, because you're going to get a bunch of misinformation. So it's much better to have kind of in your arsenal a few providers that you really trust, who that's their area of expertise and that's what they know, and they can even direct your reading. Like, I often tell parents who want to learn more about it, okay, here's a good thing to read, this not so much. Here's a good thing to read, this not so much. But the more you know, then the more options we have moving forward. So that's where the education component is good.
Perfect. Well, we'd really like to thank Dr. Sarah Berger for joining us today. Very kind of you to come and visit us today. And we will have more information about Dr. Berger on our website on www.scottsdalepbs.com. You guys are welcome to come look at her bio, and we're going to be making some more videos talking all about the assessment and diagnosis of all kinds of cognitive behavioral developmental disorders that children have. So please come visit us at our website. Again, www.scottsdalepbs.com.